And to answer your question, no, I don't have the actual figure for you, and that's because we're still in discussions with the various different systems, and also discussing the level to which that they should be continuing to provide service, and also other assistance that they're able to access. This is a package which runs into the millions. It's not a small endeavour to do this, and I mentioned the particular systems to which it will apply. More details soon. But I also want to say that we heard, actually, I think in a comment earlier, these systems are running way below ordinary capacity, and quite rightly, because people are following the social distancing, please don't go out unless you need to, instructions. So it is a case of finding a route with them which allows them to remain viable entities, but not continue to run exactly the same service that they run at the moment. But we're actively in touch with them, and I think it's good news today that we've announced there is going to be a multi-million-pound package to ensure that those light rail systems, which are excellent in all cases, can continue. Jenny.
Thank you. So this is a hugely important and hugely complex subject, so you actually may wish to stop me if I get into full flow. It's really important when we look at disease prevalence and severity, and particularly which individuals are losing their lives. We always look at different characteristics, whether that be gender, whether it be age, or in this case our focus is on black and minority ethnic groups, and trying to untangle all of the different elements that might indicate that there was an excess of severe disease, an excess of catching the disease in the first place, or even more importantly, those people who die from the disease, is very complex. And if I just give a few examples, number one, our data has to be very, very good, and even the recording of ethnicity, both by a country of origin, for example, or an ethnic group which somebody feels part of, that is hugely complex. So a death certificate will give the country of origin, but that may well not give anything to do with how the individual has lived their lives, or the community that they've lived in, or the sorts of exposures to disease that they may have. So there is a huge amount of work ongoing on this. As soon as there was an issue potentially identified, and I say potentially because I think we need to wait until we have very, very clear data. There was a meeting of senior clinical professionals, and Public Health England announced, or it was announced a couple of days ago, Public Health England will be doing a very detailed review into this. The sorts of things that need to be looked at, and I know will be, it's not just as simple as the ethnic position, but it will be things like, for example, what other conditions we know that individuals from particular ethnic backgrounds suffer from. So hypertension, high blood pressure, is something which we know carries an increased risk of severe disease and poor outcomes in COVID, and that is also more prevalent in some ethnic minorities. So it's actually untangling this. I think the other things, though, are there some very important things. It's not just the underlying conditions, it's also about how people live their lives. So this disease will transmit more. We're all taking social distancing measures if we're very close together. So people who live in close communities may well have poorer outcomes, or more likely to transmit disease. And obviously also many of our black and minority ethnic groups are in different elements of socio-economic status, and that is a really important point that also needs to be considered. I think the final point I'd just make is that actually it's really important that we engage with those communities to understand. And in this country, we have very, very high representation in the NHS, so huge numbers of workers in the NHS and in our frontline care services are from minority ethnic groups, and so we need to understand how they are represented. I know, for example, in healthcare, in the very sad deaths in health workers, it may be that that is proportionate to the very high benefit that they provide to our health service, in the sense they are overrepresented. I think it's about 45% of doctors in the London area, for example, are from minority ethnic groups. So very, very complex. All of those things need to be considered, and they are under very active consideration.
Thank you very much indeed, Jenny.